Colorectal cancer is the third most common cancer diagnosed in both men and women.
In Eye on Health, Latrice Curry talks to a woman who says she's the perfect example of what can happen if you don't get screened.
Katie Perry is a social worker at Erlanger, but back in 2019, she became a patient after getting sick and not being able to figure out what was going on.
I threw up the whole year, and it didn't matter what I ate or what I did, exercise or not. Some days were good and some days were bad, but most days, by the time I got to the diagnosis, it was bad.
Perry was diagnosed with colon cancer during her screening, which she got at age 50.
And it took me turning 50 and it being time to have that colonoscopy for it to be found.
The American Cancer Society recommends that people at average risk of colorectal cancer start regular screening at age 45. Perry recently had another setback.
So I'm now stage 4 metastatic colon cancer, and I have done 8 weeks of treatment that were one of the hardest things I've ever done.
Perry did not have a family history of colon cancer. She says getting the diagnosis was like going through the 7 stages of dying.
Because I could think of nothing else. When you wake up in the morning and put your feet on the floor and go, I have cancer, it is a slap in the face. And again, thank goodness I've got good coworkers, because I was non-functional really for 2 weeks.
Perry says she is the perfect example of what not to do when it comes to getting your colon screening.
The screening can save your life. If I had had my screening done a year before, or gosh forbid, the 45, when I turned 45 and had the screening, perhaps I would not have had cancer.
Latrice Curry with that story. Now, Perry is scheduled to have surgery to remove the tumor from her liver. She hopes to get a good report after the procedure.